depends on, it has to do with both. It's as if, okay, do I have the energy to restart this?
Mm-hmm.
Because as we were before, it was a natural thing.
Right.
There was no cog in the wheel. But now that cog has made us want to, it's as if, Grace, we don't even have the energy to start, all that all over again.
Well, and how does the partner feel about that?
Most of them are in agreement.
They are.
Yes, most of them are. And a couple of them, to be honest, have said that they have given the partner the chance to go out.
The sex piece of it is is way down the road, because all the things that you just brought up about the person who's going through the physical parts of it, and then the person who's involved with them, and all of the dynamics, the two circles and where they intersect and don't intersect, all that stuff really needs that work. A lot of that work needs to happen before you get to a place of them saying, let's try it,
Mm-hmm. True,
right?
true, true.
Yeah, yeah, or not try it and let's agree to, you
Oh,
know,
there has to be some agreement. Otherwise, it wouldn't,
mhm,
both
right,
have to be willing to try.
yeah.
You understand? Mm-hmm.
Yeah,
Mm-hmm.
yeah. It's tough. I mean, it's tough for the person who is affected by it, but not physically affected by it, because then what
Mm-hmm.
do they do with their needs?
Exactly.
Hmm.
That is frustrating,
Yeah,
and then
yeah,
in many cases, there are not many people you can confide in about this kind of thing. So you're like,
correct.
okay.
That's also why I think that if you look at intimacy as
Mm-hmm.
not just intercourse,
Mm-hmm. Mm-hmm.
that intimacy, because there can be more than just like you said, just like two people living in the same place and legally connected, but there
Mm-hmm.
can be intimacy physically and emotionally that may be satisfying enough that it still creates a more satisfying relationship,
Yes.
even though it may not be what it was before.
Yeah. It'll take time. It'll take time.
And a lot of talk and a lot of healing.
Yeah.
Hmm.
Absolutely.
And I think that for the most part, this stuff goes by the wayside.
Mm-hmm. Do you know of any therapies that could help cancer patients as regards, these sexual challenges that they may have after cancer?
Well, there are some sex therapists, that not many, that are around that do specialize in working with people who, side effects of cancer. Mostly women. There are some organizations, some cancer organizations that will have like a webinar on sexual health, and sometimes it's a doctor, a female doctor usually, that will do those things. But that's like watching like this. That's not talking.
Interactive, yes.
Yeah, yeah. No, I think you have to find a psychologist or therapist like I am that will specializes in dealing with cancer issues, and again, that will be willing to talk about it, because it isn't necessarily that all therapists are comfortable with talking about it either. Okay,
Yeah.
um, so you need to work hard to try to find someone in the communities, just keep asking questions. And but no, unfortunately, there's not a lot. Although there are good talks about it, and
Mhm.
that's better than nothing. Okay, that there are doctors that are trying to address this. But on a one-on-one, like talking about like some of the things that you and I were talking about in
Yeah.
terms of a couple and how they negotiate all this stuff, or how the person intimately looks at themselves.
Yes.
Not specifically that I can tell you, no. Not unless
Okay.
you get a good person who's willing to talk about it
Hmm.
and to bring it up, whether it's a doctor or a therapist. And you have to bring it up. When I was doing my marriage and family therapy training years ago, one of the instructors said, if you're not talking to a couple about their sex life, you may as well not be doing the work,
Hmm.
because you're missing a huge part of how they relate to each other
Yeah. And
if
it
you
takes
don't.
two. It takes two. You
Right,
can't just be dealing with one person.
right.
Yeah.
So it's real. So I was taught that, a long time ago.
Mhm.
That's part of who we are as human beings. Just like I talk to people about their religious connections. It's you can't, again, if you're dealing with a whole person, those pieces are important. So that's part of it, but you have to ask.
Yes.
People
Yes.
aren't necessarily going to bring it up. So you've got to find someone that's willing to ask,
Hmm.
and willing to have those conversations. you know, when you finish treatment and you get a survivorship plan,
Yeah.
it tells you what treatment you had and, you know, what
Mhm.
kind of chemo you had or radiation and all those things. I think if they could put into that survivorship plan, these, at least these are possible issues that may come up for you. And if they do, you know, the door is open to talk about it. And there could be a piece in there on sexual health. It's something.
It's more than something, because this is what people want to know about. I mean, when
Mhm.
these things start manifesting, they're like, okay, dry vagina, or "Oh, what's wrong with me? You understand? Am I
Mhm.
going crazy?" If they had already been informed about all these things, it wouldn't come as a shock, because now they have to deal with the secondary syndrome. You understand? It's like,
Right,
okay, I've
right.
just finished with something else, and I have to deal with something else. You
Mhm.
understand? So that would really help, because you think you're going crazy. This
I
is your
know. So yeah,
emotional, yeah,
yeah, that was something that when I was speaking with him about doing this podcast, he said that's a way that they're looking at building in some of
and the
those issues.
survivorship care plan. Yes,
Yeah,
you
yeah,
know,
yeah.
post-cancer. It's much
Hmm.
needed. It's much needed. I think even in Europe, maybe not here in the States yet, but I know that they have started doing that in Europe. They don't, no holds barred. They're very direct and
Yeah,
straight about these things, and they let their patients know that
which would be, yeah, it would be wonderful.
it would be
I
wonderful.
think there's another piece that may play into this is that, you know, when there are pelvic floor physical therapists.
Hmm. That deal with the collapse.
Well, they deal more with, like, generally speaking, they deal with bladder, yeah, you know,
Hmm.
bladder incontinence issues, which also sometimes part of post-treatment issues.
Yeah, yeah.
But they deal with a lot of like, there's an internal exam, there's part that's often part of that process for people with bladder control issues.
Hmm.
So I'm trying to think, I spoke to someone right after I finished treatment who was a physical therapist, somebody, I can't even remember now, Grace, who got me to her. And I spoke with her on the phone. She was at working at another hospital. And she said to me, you just have to keep trying. You just have to keep trying. And I remember her saying, like, you got to use a lot of slippery stuff and blah, blah, blah. And I said, well, do you have a particular type of slippery stuff that you recommend? She said, yes, it's called slippery
I
stuff.
know, right?
And I had one meaningful, half an hour conversation with her, but I think she was a physical therapist that dealt
Okay.
with pelvic floor stuff. So I think they're not trained to deal necessarily with all the issues that go with cancer, though. So I don't know. I mean, it would be like maybe something in the future that could be.
Part of their training and stuff like
Mhm,
that,
yeah, yeah,
because these things are not taught. And because they're not taught, they feel them it's not important. You
I know.
understand? And
Yeah,
that
yeah,
healthcare has evolved. It's no more bits and pieces. It's the whole care, whole body care.
exactly, exactly.
So
Yeah, yeah,
yeah,
yeah.
yeah, that would be wonderful and very
Hmm.
welcome too.
I know.
So
Yeah,
because
if someone said there is someone you can go and work with on these things, again,
yes.
the practitioners have to be comfortable enough
Mhm.
to do it, with the
Yeah,
whole topic. I mean, we're all humans and most of us are not all that comfortable talking about all this.
yeah. But it's the 21st century, yeah. The more we Yes, the more we thrash it out, the more it's not. When they keep sweeping it under the carpet, it's like a taboo, you
I
understand?
know.
And you
Hmm.
can't get round to these things. I mean,
Hmm.
you look at our kids now and stuff like that. What are we leaving for them? They have to know these things, you
I
know.
know. Yeah.
They
Well, do
have
you
to
remember in the old days when women would have a radical mastectomy and they would take, I don't know if they would take out all of the chest wall muscles.
Yeah.
So physically, on top of the disfiguration because then your chest would sink.
Mm-hmm.
Now at least they leave, generally speaking, unless,
A bit of flesh there.
yes. So, their muscles would be gone here, their shoulders would rotate in,
Mm-hmm.
and that was never, women were not even offered physical therapy for that. So it's changed, it is evolving and it is better. Surgeries are less barbaric and the And there's more
And they will
physical.
tell you, that even with the muscles that you have left, you make sure they don't tighten up, exercise, stretch, those kind
Mhm.
of things. Because once you leave the muscles, unstretched for a long time, of course it's going to hurt. Because you hear people say, oh, my chest muscles, what is left of them
Of them,
hurts. And I'm
yes.
like, well,
And
do
fear.
you stretch? You have to stretch. You have to try and lift stuff, and bend down and push and all that.
Who's talking to them about that too, Grace?
Yeah, because I have a lady that she's a physical therapist that I
Hmm.
refer them to her as
Uh-huh.
well. She has been on my podcast before.
Yep.
So they even have these things virtually. So they're in the comfort of their room,
Yep.
and she's the one that, starts with them and say, okay, this is what you have to do. You have to, first of all, you have to breathe because you have to talk about, chest muscles, it's your lungs, it's
Yes.
breathing.
Yes.
These things have been affected.
Hmm.
And so they follow and they have felt so much relief. Over the
Hmm.
years, I interviewed her about 2 years ago, just to let you know how long I've been doing this. I've been doing this like for about 6 years,
Yeah.
and they are still with her. You know,
Oh, that's great.
they are still
Yeah,
with her.
that's great.
And
Hmm.
it's been wonderful. The vibes, the good vibes
Hmm.
she receives from them, and they receive from her too, because she had a sister that was a breast cancer survivor, and she really knew exactly what they were feeling,
Yeah.
what went into it.
Right. And yeah, and so the stuff that you're talking about in terms of the muscles getting tight
Hmm.
and that's the reason for the vaginal dilators, because
Hmm.
same thing can happen to the muscles in your vagina, right? They get
Hmm.
atrophied and then, you got to keep stretching them out. You
Hmm.
got to keep, and also because, if you're a gynecological cancer survivor, part of your exam every time you go in to see the doctor is an internal exam.
Hmm.
So they have to be able to get in there, and if you atrophy and it closes up, they can't. And it's problematic. But it's the same concept. Your
Hmm.
muscles, and especially if you've had radiation,
Hmm.
radiation creates scar tissue, and your muscles tighten
Yeah,
up,
yeah,
right?
contract. Yes,
Yeah.
exactly.
Yep.
Oh, that's just so much, honestly. These
There is.
long
There
term
is.
side effects. Oh wow, that has
Yeah.
been so interesting to know, and really, a lot of people are going to really learn so much about this during this
Yeah.
episode. What um would you like to say to that patient or survivor that is watching right now, um, as your advice or parting words?
On your quest to be healthier, keep asking. You may have to ask a lot of different places to get the answers that, and the help that you want, but don't be afraid to have the conversations.
Thank you so much,
Yeah.
Kathy. Honestly, I wish I could go on and on with you. This has been so enlightening, but it's been a wonderful conversation. Thank you for sharing your story as well, because like we were saying, it takes a lot for somebody to be open as you are to share your own experience,
Right.
especially with a cancer that is, you know, kind
It's
of makes
private.
the women
Yeah.
very vulnerable, you
Yeah.
understand? And
Yeah.
I know people are going to be amazed and empowered by you sharing yours. So thank
Well,
you
if
so much for
you're
doing that.
welcome, Grace. If we don't talk about it, it's never going to change.
True. Very true.
So I feel like I have to talk about it. It's
Hmm.
important.
Hmm.
So,
That's why we do what we do. Demystify all this.
but thank you again
Thank
for
you so
having.
much for coming.
Yeah.
And I'd like to wish you and your family a very, very Merry Christmas.
Thank
Thank you
you.
so much, Kathy. God bless you.
Thanks, Grace.